Good morning, and welcome to our first ever virtual Cancer Policy and Advocacy Team Symposium. I'm Shelley Fold-Nasso, CEO of the National Coalition for Cancer Survivorship, and I want to thank you for joining us for this important event, especially now, particularly now. None of us could have predicted the challenges this year would bring. The COVID-19 crisis has been devastating for our country, and this worldwide pandemic is compounded by the trauma of our brothers and sisters suffering from racial injustice. Over the course of this conference, we want to address these issues head on because we know they are deeply affecting you, our advocates. But in a strange way, cancer survivors seem to be uniquely prepared for this difficult time. For those of you who have heard the words, "you have cancer," you've likely been through confusion, isolation, financial hardship, anger. But through all of that, you are here today to learn, to grow, to advocate. For years, our motto at NCCS has been choose hope. Our work is centered around finding policy solutions to improve cancer care for everyone touched by cancer. That policy work starts with hope. People are living longer with cancer than ever before, and we want them to live better too. In the event registration form, we asked you to tell us what you look forward to when you wake up each day. Despite everything going on in the world, you said that you look forward to simply having another day to live your life. A few responses that stuck out to me: a day closer to completing treatment, being with family and friends, a peaceful home, warm doggy kisses, and my sweet family. That first cup of coffee, and then seeing my kids' faces and snuggling with them on the couch. Living life to the fullest and spending time with the people I love the most. The opportunity to make someone smile each day. I love these responses and how much you embody hope, even during the most difficult times. We're so grateful you're here and spending time with us today. We have a fantastic lineup of advocates, experts, writers, and thought leaders who are going to lead us through important discussions on how to improve cancer care. As you may know, NCCS launched a podcast, Cancer Convos, this spring. Lindsay and I are both podcast geeks, and we compare notes on the various news, politics, healthcare, and true crime podcasts we follow. We have wanted to start a podcast for a long time so we could channel our inner Oprah. With a global pandemic changing everything about how we do our work and heightening the need for information about cancer and COVID-19, we decided now was the time. Why not jump right in? We interview cancer survivors, policy experts, clinicians, researchers, and more. We started with episodes talking about COVID-19, but we have many other topics in store in the coming months. We've had fun recording episodes at home with our kids around, trying to keep them quiet. My first episode, I had a blanket over my head to reduce sound outside. But fortunately, our resident technical expert, Zach Biondo, told me that I could sit in my closet and the clothes would fashion a sound booth. That proved to be way more comfortable. So in the spirit of Cancer Convos, for our opening session, we have 4 Cancer Convos, all with people living with metastatic cancer. To kick us off, NCCS Senior Policy Manager Lindsay Houff will have a conversation with renowned author and social commentator Caitlin Flanagan. Lindsay?
Thanks, Shelley. Hello, everyone. I'm Lindsay Houff. I'm the Senior Policy Manager at NCCS. And several weeks ago, we shared an essay with all of you that was published in The Atlantic by Caitlin Flanagan. And the piece is titled, "I Thought Stage 4 Cancer Was Bad Enough." And it clearly resonated with so many cancer survivors, and they're having to navigate a cancer experience during a pandemic. Could it get any worse? She writes. Caitlin Flanagan is a writer, social critic, who was nominated for the Pulitzer Prize for Commentary just last year, and we are so incredibly honored that she's here with us today to talk about her cancer experience. Welcome, Caitlin.
Thanks for having me.
So the past few months have been difficult, to say the least, and especially difficult for those who are particularly vulnerable to COVID-19 because of a cancer diagnosis. So I'm just curious, how are you doing and how have you been coping through this uncertain time?
Yeah, well, part of the problem was it was just so hard. It's still hard. I guess people don't know much really about COVID yet, because there was so much information that was not true and then is true and isn't true. And, I go in for treatment quite often over the course of a month. And just the thought that I'm going to expose myself potentially to COVID because, I'm in a hospital setting where people are sick, and obviously there'll be patients with COVID. And just the notion that it could attack the lungs, and I have some issues with my lungs. So it's all been really an extra layer of challenge. And then everybody in my sort of group of patients anybody who had a scan, CT, PET scan coming up that wasn't absolutely urgent, we all got pushed out to give us less time in the hospitals. So I just got my scan and everything's stable and I'm happy, but it just postponed that by a good 6 weeks. So it was a very stressful time added on top of the cancer.
Yeah, I can imagine. And are you, how are you doing with the social isolation? I know you have a family, and how is that working out?
Well, again, it's so hard to tell what we're supposed to do. Know, I live in Los Angeles where we've had, this unrest, uprising, and I've seen so many young people near my house that aren't social distancing at all. And, they've said that they would rather risk COVID than not speak out, which is, so incredibly telling about the situation of race in America. And yet I look at them and think, good that they're young, but also, I saw them just shoulder to shoulder to shoulder near my home. And again, that was what makes the protests so stunning, is the sheer scope of them. But on the other hand, are we going to experience a spike? Are they going to experience a spike? We just don't know. And that's been difficult for me. And the isolation. So anyways, because of those changes, then I started to think, which I probably shouldn't, well, maybe it's not so bad to be outside and around a crowd, maybe I can let down with the social isolation, but then my doctor tells me that's not true. So, it's just trying to figure everything out in this puzzle where we've got our own metastatic disease, we've got a global pandemic, and then we've had this major social justice sort of upheaval, as we saw a man murdered on television, and just millions of people said that's it. So it's a strange time.
Yeah, definitely. And that's, we're hearing that from patients and cancer survivors across the country, that this is just, a really stressful and unpredictable time. And there's just so much uncertainty. And I want to talk more about your piece in the Atlantic. So after reading your article, I immediately signed up to watch a virtual interview that you did with the Atlantic. And in that interview, you talked about what it was like to tell your two young boys that you have cancer. And I was really moved by that because I've been in the cancer policy world for several years now. And I lost my dad to melanoma when I was 11, but this was really the first time that I related to a public discussion about cancer, because it made me think, how rarely kids of cancer patients are included in conversations about the disease. And so I really love that you shared how deeply you wanted to downplay the seriousness of your diagnosis, or that you even wanted to hide it from your boys. And I can only imagine how that feels. And it reminded me of a conversation, when my parents told me when I was 9 that my dad was sick, but, don't worry, we're going to get to go on a road trip to Duke University. It's this really amazing place, and they have escalators there. I'm from a very rural town in Virginia. I'd never been on an escalator. So that was sort of my grand takeaway from the cancer treatment. So I just wanted to say that I really appreciated you highlighting that piece of the cancer experience. And I wanted to ask if you'd share more about how you ended up telling your boys that you had cancer and what was their response.
Well, when I was first diagnosed, which was 17 years ago, I had two little boys, twins. They were 4 years old, almost 5. And my terror of my disease was almost incapacitating. I was so terrified. And, half of my terror was for myself, and probably over half of it was for my little boys. And what am I supposed to do? And the mother's instinct always says, protect, protect, protect children from anything, scary or upsetting or whatever in the adult world. It's too soon for them. And so I kind of developed this whole kind of language of euphemism, sort of saying, well, I had a bump and I got sick and now I'm taking medicine, and this is a kind of medicine that will actually make my hair fall out. And, I thought that was enough. And then I happened to go at UCLA in Los Angeles. There is a clinic that anybody can go to. You don't have to be a patient there. That's just for the psychosocial aspects of cancer. And I went in one day looking for a social worker I'd gotten to know, and she wasn't in, but there was another one. And so we sat and talked, and she said, well, what are you telling your boys? And I gave her my euphemisms. And she said, no, 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 because they're going to think the next time they get sick and take medicine, they're going to think that their hair is going to fall out and they're going to be in a terrible situation and they'll be bedridden for lots of time. And the next time they get a bump falling down, because that's what I said with my tumor was a bump, the next time they get a bump, they'll think, oh my God, what's happened to me? And she said, you need to give them the very particular vocabulary so that they can just have a language to really understand that this is a distinct thing. It's a different thing than they will experience as children. And that most importantly, we've got their care figured out. And I didn't want to tell, oh, I didn't. I just thought she was the worst person in the world. And I would never, ever want little 4-year-old boys to know about chemotherapy. She said I had to use that word. But she gave me one of those children's books. You know, there's a specialty children's book for almost anything you can find yourself in. And they're never the book you want to read your children. You just want it always to be so happy. But I brought it home, and it was about a little boy whose mom had breast cancer. And they stared. I read it to them. They stared at this book as though it was the most essential information that they'd ever seen. And one of them, my son Patrick, as soon as I was done, he grabbed the book, he ran out the front door, and he ran next door to show the nice lady who lives there and say, this is it, this is what's happening. And suddenly to have that language, to know as much as they could what's going on at home, was tremendously calming to them and to everyone. And so I realized that, you know, letting them in an age appropriate way on what's going on is actually better for them, much better for them than this sense that there's a lot of whispering, something terrible's going on, mom's lost her hair, you know, all that is terrifying. And when there's at least a language that makes sense, it reduced their stress a lot.
Yeah, I can imagine. And I'm sure too, having the language also was meaningful for you as well, and maybe sort of cathartic as you know, explain it in basic terms and kind of say it out loud, and share that with them.
It wasn't so much cathartic for me. It was more feeling, oh, this is the right thing. You know, you're always worried when you have children, even if you don't have cancer, am I doing the right thing? There's so much advice on magazines and the internet. You never really know. But every now and then you'll do something and you're like, oh, this is the right thing. I'm handling this in the best way for my children. And that's what I felt when I read them this book, and when I introduced this vocabulary. I could clearly see that as much as I didn't want to do it, it was very much the right thing for them.
Right. And along the lines of language in the cancer experience, I'm curious to know, what was something that was said to you during your diagnosis or maybe through your treatment that made you cringe? I know a lot of people hate the phrase a cancer journey. I think now most of us can't stand to hear everything happens for a reason. You know, some people don't even like the term survivor, which we understand. But I was wondering, you know, for you, what was something that someone said that just really bothered you?
Well, you know, in the beginning, I just didn't know anything about cancer. I didn't know anything beyond what you just read in a magazine or you might see in a movie or hear about maybe a celebrity that might have it. I didn't know anything. And I was absolutely convinced that the reason I had this cancer was that I'd done something wrong. I mean, like morally, not like just, you know, eating the wrong foods or whatever. I just felt there must be a punishment. How could something so terrible be happening that wasn't kind of a punishment? And and then so many people would say attitude. It's so important to have the right attitude, as though you have to, in addition to everything else, you're so sick, you feel so terrible, you're lying in bed, it's the worst time in your life, and you're supposed to have a great attitude. And it was just so upsetting to me. And then I went back to those social workers who were so great. And I said to one of them, I just feel so bad. Obviously, this is a punishment. And she said, of course, that what people always say is like, you know, children get cancer. We all know wonderful people who have gotten cancer in our lives. It doesn't have anything to do with how good you are. It doesn't have anything to do with it being a punishment. And she said, I've seen a lot of people come through this clinic who were just some of the nicest people I've ever known. And conversely, and they passed away. And conversely, I have known some of the biggest bitches I've ever met, and they were fine. And I was like, oh, okay, I'm certainly not the biggest bitch, and I'm certainly not the angelic person, but if there's that kind of range, I think I'm going to survive. Your attitude doesn't matter that much. And of course, there's all those research studies that show it really doesn't. But the other thing, and I say this to people all the time myself, and I have to catch myself in all sorts of situations, but when they hear what's going on, and a friend would say, I can't even imagine what you're dealing with. I just can't imagine. And it would make me feel that I was so far beyond any kind of normalcy, that people couldn't even imagine what it would be like, that anything that was going on at home that I felt like, well, this seems to be going well during treatment, the kids seem okay here, was just that terrible. And I still, but as I say, often it's a saying that I think it's in a lot of our minds for all kinds of things. And it's supposed to be an empathic thing to say. Someone tells you about, a terrible trip or an actual sad thing or something, and you say, oh, I can't even imagine. And I just think we got to try to get rid of that, because it just suggests you're even beyond the realm of imagination. That's how bad your situation is.
Right. Like, I can't even go there.
Right, exactly.
So it sounds like, too, that you had a good support system, and you're talking about a social worker and some of the psychosocial support that you were able to get. So I'm curious about what kind of patient you are. So would you consider yourself a self-advocate? At NCCS, we promote self-advocacy. We even take it a step further. We do political advocacy. We train our CPAT members on how to tell their stories to policymakers. And so that's really important for us. It's not necessarily for everyone. And we recently conducted a survey, and it's one of the breakout sessions that really does a deep dive into those results. And there's a difference between a connected patient who really advocates for themselves, or a typical patient who really wants to know what the doctor thinks is best for them. So I'm just curious what kind of patient you are.
Well, again, in the beginning, I was so profoundly terrified that I just wanted to start treatment. Let's just get it started. Let's find someone. And someone had been very recommended to us, and I liked him very much, and he was at a big practice in LA, although he did several different kinds of cancer, which to me now is something if you have a chance, I think, to work with someone who works primarily with your kind of cancer, I think that's always a great boon. But in those days, it was really my sister and my husband who were doing all the thinking and all the connecting. But what I would say is my geographic location was just this incredible privilege, because in Los Angeles, there are so many services for cancer patients that are free, that are open to all, from social workers at one hospital that anybody can go to different programs of yoga or art or whatever that are free. So there's all that kind of psychosocial support is fantastic. And then we have these research centers between UCLA and between USC. We have big research hospitals that are working, around the clock on these different diseases and forms of cancer. And the biggest privilege I had was my insurance. I had just an excellent kind of insurance through my husband's work. So once I heard about a better practice with better results, once I had a recurrence, I was able to get that appointment very quickly because of people I'd met along the way. And I was able to transfer my insurance over there immediately. But I see all the time, because UCLA will have a certain number of patients who really don't have any insurance at all. And I'll see them, in treatment, and we'll talk. And you realize that the gap between living in the right place and having the right insurance and having kind of being in some way connected, in this arbitrary way to some of the gatekeepers for all this, that all of those hoops to be jumped through for people who don't have those things are just too many. That's just, I mean, it's just, it would be impossible to me to try to think that I'd have to fight with the insurance around the clock. I'd have to try to get an appointment. I wouldn't know where to get a second opinion. So I definitely saw layer upon layer upon layer of this built-in uh, privilege that was, again, you know, that is rare. You know, that's rare to have all those things: great insurance and to be in a great city for cancer. So I didn't really, I was not personally an advocate, but my sister and my husband were advocates for me.
Yeah. And a lot of what you were just talking about, just the navigating, the work it takes to navigate the complex health insurance system and healthcare system, is just so intense. And we have a breakout session later that talks about the work of being a patient. And it is just that. It's a lot of work. And really we should have a system where you don't have to be a self advocate to get good care, and you don't have to know someone at an institution, or be lucky enough to have great insurance to get the best care. And so thanks for touching on that. That's something that we really care about at
Yeah,
NCCS.
of course.
Um, so, and to bring up, I guess, the positive second piece of a previous question that I asked, I'd be curious to know, what's the best thing someone said to you in your cancer experience?
Well, the best thing would be that idea that you know, it didn't matter about my attitude. I didn't have to try. It's so much work to have cancer treatment. It's so much work to think about having cancer. It's so much work to try to do your work when you have cancer, your paid work. It's so much work to deal with your children, that the idea that then people kept giving me, it was just when Lance Armstrong's book had come out. It's not about the bike. This is before we all knew that he was, you know, a scammer with his doping. But people, everybody that came to the house would bring me that book. And it got to be kind of a joke, because as soon as they left, I'd go to the hall closet, open the door, and just throw the next one in. I mean, I had half a dozen. But that book is not a very good book, I think, for people with cancer, because he's just talking about the fight and the struggle and all the things he did right and why he was right, and he was right so he got better. And just finding out that that you didn't have to be, you just had to do your treatment. And then you just had to take your evaluations, whether it's scans, whether it's blood work, whether it's both. That's all you have to do for your cancer. And stay in touch and keep all your appointments and question anything you're not sure of there. But the idea that you're going to have a whole new personality grafted onto this was just overwhelming. So the idea of finding out that this research says you really don't. I mean, it's always great to have a good attitude. You get things through things more easily, and I'm sure compliance is probably higher for people who have a good attitude about things. But if you're, you know, I just had a bad attitude. I was really scared. I couldn't get out of the terror. I just couldn't believe that I'd been walking a long life, healthy, and then I just felt like I just fell into a sinkhole, and there was no bottom to it, and I couldn't possibly get out of it. And then at the lowest moment of my life, I was supposed to become this cheerful person. You know, it was just really overwhelming. So it was good to hear that no, you don't have to do that. You just have to take your treatment and get some tests and see how it's working.
Right. And I think that can, be applied to so many other things too, especially like experiencing, like, does it get any worse having cancer and going through a pandemic? So
Right.
what do you see being some of to look for the silver lining, I guess, in this whole thing? What, what kind of changes do you think this is going to make in our society long term with going through the COVID experience? We're still in the thick of it, although you might not know that depending on where you live. But I think that's part of the hard part. Like, there's just so much conflicting information, and it's a really scary time, and none of us have enough information. So just long term, looking forward, what do you see that looking like?
Well, one thing I feel that our public health, officials really let us down in multiple ways. I remember when there was that whole thing, oh, you don't wear a mask. Masks can't help you. A mask won't do anything. A mask will keep you from spreading it, but it won't keep you from getting it. And I thought, how could that be? That just doesn't make any sense. Why would it not be helpful to have a mask? And then finally, they admitted that it was helpful to have a mask. And no one's to this day really sure why they said the first thing. Were they just trying to preclude panic? We just don't know. And then in terms of the protests that have been so powerful and so global, public health officials wanted to be supportive of the movement and sort of said, well, if the multiple intersecting levels of race and access and cancer or illness are so important that go ahead and march. And I thought, well, I think it would be better to say, you really will increase your chance to contract COVID, but clearly this is a matter that is of such grave importance that you've decided to take that chance. I just think public health officials tried to be political, tried to say what people wanted to hear, tried to save their own bacon in a way by not, no one would ever want to say anything against the protest of the, biggest event in America in my life, biggest kind of protest. But so they just kind of backed away from their duty, which would have been to, we saw all those West Point cadets that were graduating the other day, and they're all very carefully 6 feet apart from one another. And I just think public health officials are going to have to be more honest with people.
Yeah, absolutely. And the leadership through all of this, has been a difficult piece, and we're all trying to navigate a lot of rapidly changing information, and thank you so much for sharing your perspective with us and sharing your cancer story and how you're coping with that. And again, thank you for your article in The Atlantic. I think so many cancer patients related to it so much, and for sharing your cancer story with such grace and honesty. So we appreciate you being here with us today.
Thank you. I was really honored to be asked.
And Shelley, thank you. And now I'll turn it over to Shelley.
Great. Thank you, Lindsay. I am excited to be joined today by Dr. Tom Smith, who's a medical oncologist and palliative care specialist at Johns Hopkins. He's also living with metastatic cancer and wrote an important perspective piece last year in the New England Journal of Medicine entitled Time to Study Metastatic Cancer Survivorship. Thank you so much for being here with us today, Tom. I know you have a very busy clinic schedule, and so I appreciate you carving out the time. So can you tell us a little bit more about your co-author, Terry Langbaum, who survived 4 separate cancer diagnoses over nearly 40 years before she died last fall, and what led you two to write this important perspective piece?
Well, Terry was a person who recruited me here, and she, as you say, had Hodgkin's disease, breast cancer, a gastrointestinal stromal tumor, radiation-induced sarcoma, which was what eventually took her life. And she and I sat down at one point, and after a New England Journal really terrific review about survivorship, and it didn't say anything about those of us who were living with more advanced cancer or cancer that had come back. And so we thought, well, maybe we should write a letter to the editor and just say, hey, there are like millions of us out here who are coexisting peacefully or not with our cancer for however much time we have. And our concerns are very often the same, but often more complicated and different. I mean, just a few things about what's happened to me. I had surgery for prostate cancer, having failed miserably an active surveillance program when my PSA rose. And that was relatively easy, but a year later, my prostate cancer had come back. So I underwent 6 months of no testosterone therapy with androgen deprivation therapy and 2 months of radiation therapy. And that was really the hardest thing I've done medically in my life. The first thing that happened within 2 weeks was incessant hot flashes. Starting at 2:30 in the morning, every 45 minutes, I would just soak my clothes until about 4 o'clock in the afternoon. I figured since I'm a breast oncologist and had put so many women into menopause that this was just somehow payback. But the only thing that worked for me was a medicine called oxybutynin or ditropan. So there are lots of good things that help with hot flashes. Don't be convinced by your doctors that there's nothing more that can be done. And we just published an article showing that ditropan or oxybutynin really works quite well for women with hot flashes. The second thing that happened was just losing muscle mass almost immediately. Third thing was I had a TIA, which almost went into a stroke, and that's a known complication of the Lupron or androgen deprivation therapy, which I don't think anybody had warned me about. Then I had severe depression. I'd had depression as a medical resident, and I'd been depression-free for 35 years. And suddenly my mood started swinging up and down like that. And my prostate cancer team said, oh, we don't see that often. It turns out that's completely wrong. It's much more common than most doctors think. And it's much more common in cancer in general. The difference between depression and demoralization, where you just get sick and tired of being sick and tired. I had real honest to goodness depression. I ended up admitting myself to the hospital so I wouldn't kill myself. So that's my first advice. Don't kill yourself. It's really hard on you, on your family. There are lots of ways to get around that. I've been very open and honest about my depression before and since. There are lots of things that you can do to help with it. I had lung failure. You can see on the back, those are all my race tags from 50 milers, 100 milers, the Mountain Masochist 50 miler. That's all gone. During the middle of treatment, my lung function was about 50% of normal. So that my entire life has changed in that way. And I can jog at 15 minutes a mile now, but that's about it. And that's probably not coming back. And then add to that the incontinence, add to that lack of sexual functioning, lack of orgasms, which again, I don't think anybody told me about. So I can't run fast enough to get a runner's high anymore. And I can't have an orgasm to get endorphins that way. So I'm calling this my new life without endorphins. And one of the things I tell my breast cancer patients is when you have chemotherapy-induced neuropathy, and every time your foot hurts or tingles or is numb, it's a constant reminder of the PTSD experience that you have with cancer. Mm-hmm. And it's exactly the same way with me. Every time I recognize one of these losses, it puts me right back where I was into the initial couple of weeks of shock and not being able to hear, not really understanding what was going on, questioning everything about my life, et cetera, et cetera, et cetera. Luckily, I'm doing pretty well now, although my disease has come back, and I'm, as probably with many people in the audience, just waiting for the other shoe to drop. I don't know exactly when, although I know it's probably going to be soon, and to see how bad that will be, and recognizing that my time here on Earth is finite. So those are all the things I've been dealing with. And those are some of the things that Terry and I wanted to share with the world, and recognize that there's this whole group of us who are living with our cancer, and you know, as long as we're here, we're still survivors too.
Right. Thank you so much for sharing that. And I know, we don't talk about a lot of those things very often, the mental health issues, the sexual function issues. So appreciate you being so candid about that. And it's interesting too, because as you think that someone who's a medical oncologist would know all these things, but you don't know until you're there, until you're in that situation. How has has living with metastatic cancer changed how you practice medicine?
I have had the experience of having a couple of serious illnesses before, including depression as a resident and as a young oncologist, and having discovered that I have a congenital heart defect, which may take my life at some time. So I've unfortunately had a little bit of experience from the other side already. I think particularly having the depression has made me realize how common it is, how common anxiety is, how poorly our health system, particularly medical oncologists, even ask, how's your mood? Are you bothered by depression? Are you bothered by anxiety? I mean, we recognize it less than 1 in 5 times. And yet there are really good things you can do to treat depression. I've had 2 very terrific psychiatrists and a counselor, and I'm on medications that have really helped stabilize my mood. I mean, you can treat depression in somebody with cancer as well as you can treat it with somebody without cancer.
Mhm.
The other thing is, nobody in my experience has ever asked me or my family, how are you coping with this?
Mhm.
Because I would tell them and say, really not so well. I mean, here's all the things that are going wrong that I used to be able to do and I can no longer do. And cancer is so much of a family unit issue. I mean, this has been really hard on my wife. This has been really hard on our daughter, who's a gynecologic oncologist. And no one has ever turned to my wife and said, how are you coping with Tom being so ill? So I've integrated those into my practice, and I wish I could emblaze it on the inner part of my glasses to remember to ask, how are you coping with this? And then physically turn to the family and say, how are you coping with mom being so ill, dad being so ill?
Wow. Well, that's a lot of what we hear from survivors. We did a survey last year and another survey that we're going to be presenting on next week and as the symposium continues. And the top concerns we hear from cancer survivors, the long-term issues are the anxiety, fatigue, depression, and those are the areas where they feel like they're getting the least support from their care team. And also, we did a project last year on developing quality measures for functional status. And what we heard from the incredible team of advocates who worked with us on this project, it was a really intensive project, was, they aren't being asked these questions, how you're coping, and how, the focus is on treating the cancer and not treating the person and all of the aspects of their life that are affected by the cancer, including their family. I love that the family members not being, what you said, that the family members are not being asked, how they're coping. And like you said, there are things that we can do to help people. We just have to ask, but it's not at the forefront during those busy appointments that you have where the focus is just on treating the cancer.
I spent the morning doing telehealth with a pharmacy team and seeing people who are really pretty sick. And a couple times I just looked the person on the TV screen and said, well, how are you coping with all this? And they looked at me like, no one's ever asked me that before. And then you ask the daughter, the dutiful daughter, and say, I'm getting really burnt out. I mean, I don't know if I can take more time off from work. I mean, I'm getting exhausted. I need help. I don't know who to talk to. So just some simple things. And I have a really good friend who has terrible pulmonary disease right now. And she asked for advice on, well, you see your oncologist has 15 or 20 minutes for the visit. How do you get him or her to pay attention? The answer is you call the office and say, look, I have a whole bunch of questions. I need 45 minutes to 50 minutes to talk to Dr. Smith about them. When can I schedule that? And most oncologists will do that. Or it doesn't have to be the oncologist. Frankly, social workers, counselors, nurses, advanced practice nurses, they can all do much of this work to help us adapt to something we didn't ask for.
So basically asking in advance, saying I need more time today because I have a lot of questions.
Yep. So I've got a follow-up visit with my radiation therapist, and some of the things that he explained to me don't make sense. So before I see him in October, I will send him a list of questions and say, these are the things that I need to be explained. I need you to explain in a way that I can understand them because they don't make sense to me. Do you want to do this during our 20-minute visit, or do you want to do it afterwards?
So one of the things you and Terry wrote about in your article was about coordination with primary care. And obviously, you know, you have different doctors helping you with different aspects of your care and different aspects of your side effects. So how do we need to do better to have better coordination of care? I mean, you're equipped to do that yourself because of your training, but what about all the people who can't, but still end up having to be the coordinator of their own care?
Probably the first thing is when you see your oncologist or your surgeon or your radiation therapist, ask them, do you have a list of my other doctors? Are my other doctors getting the information? Because we use Epic, and Epic is notoriously poor at having that information. It's not that Epic is poor, it's somebody has to physically enter in. My primary provider is so-and-so. My radiation oncologist is so-and-so, and you have to match them to make sure that they get any information. So you can ask your doctor's office, is my primary care provider even being kept in the loop? The other thing is make an appointment with your primary care provider. I'll be honest and say, having been a primary care provider, not all primary care providers are up for this. Cancer patients, and particularly cancer survivors and people with metastatic cancer, may be a tiny fraction of what they do, and they may not feel comfortable with it. Others will say, hey, I'm your physician, I'm your nurse practitioner. I really want to be able to manage your high blood pressure, your diabetes, your coping, make a referral to social work or counseling if you need it. I want to be in there pitching with you. You're not going to find out what type of primary care provider you have, and really until you ask.
I think one of the things we need to do is help cancer survivors find those primary care doctors who will be the latter and who will really take the time to figure out and help coordinate the care and learn what they need to learn to really effectively manage a cancer survivor's care. And we know that some of them, I mean, the demands on them are overwhelming. They don't necessarily have the time, but there are those primary care docs who've really devoted the time to understanding what they need to know to really take care of cancer survivors.
Yeah, I mean, when I send a breast cancer patient back to their primary care provider, I want to make sure that they're going to ask about cognition, ask about chemo brain, and know that yoga seems to help, and know that meditation seems to help, and be aware of sort of the ongoing science. I want to make sure they know about pulmonary complications, bone complications, and osteopenia. Make sure they're measuring the person's bone health. I want them to ask questions about, are you having sexual desire? Are they having sexual thoughts and fantasies? How about the physical practice of sex? How have you and your partner managed this? And can we help you with that? Again, not all primary care providers are going to be up for that. I've actually found the most support from an online community called Inspire. I'm in the prostate cancer group. And I remember telling my team, you know, I'm having a heck of a lot of problems with this androgen deprivation therapy. And they looked at me like, nobody has all those problems. And I typed in on my online community, these are my problems. And they sent me to a group called The Hell of Lupron. Other people had been through the same thing. And I've given a lot of Lupron to young women with breast cancer, and I simply wasn't aware of some of the side effects that it had.
Yeah.
Which I apologize.
Well, and I think, you know, we hear that all the time from survivors. They learn more about their treatments from their colleagues who are going through the, you know, from other survivors when they connect on an Inspire or some other advocacy group to really talk about, you know, what's it really like to have this treatment that, you know, only somebody who's actually taken that treatment will understand.
Yeah.
So we also hear from people with metastatic cancer that they're excluded from survivorship programs at their cancer center because they're not post-treatment. Can you talk a little bit about that and what we need to do better to provide those same kinds of services and support to people living with advanced cancer?
Sure. It's a little bit different whether you're going to be a survivor for a couple of months or going to be a survivor for a couple of years. I mean, people with metastatic lung cancer, for instance, Up until a few years ago with immunotherapy, nobody was alive at 5 years, or very few people. And I've got 15 to 20% of people alive at 5 years. So those people need help with cognition issues, lung function issues, activities of daily living, sexual health, all the things that we would normally be talking with a group of people that we assume are cured of their colon cancer and breast cancer. We don't actively exclude them from groups, but I think they're sometimes not encouraged to go. I don't have a good solution for that. Lillian Shockney here has put together a number of metastatic couples retreats, and that's been really helpful. It's nothing like sharing the problems with other people who have experienced the same thing. Yeah. Sometimes even just talking about it, talking about your anger, talking about your fear with somebody else who's been through the same thing is the most valuable tool in the toolbox.
Right. So as a palliative care specialist, can you talk about the role of palliative care? And what do we need to do to make sure that more people with advanced cancer get early palliative care and how do we overcome the stigma that some people still believe palliative care is hospice care?
I think that stigma will always be there. So palliative care started really on the backs of hospice. Those of us who were there with the beginning of hospice know that hospice pays attention to your physical needs, your psychosocial needs, your spiritual needs, your family's needs. What do you need to be as functional at home? And we've been trying to swim upstream for the past 30 years. And my society, the American Society of Clinical Oncology, says every advanced cancer patient, whether they're curable or not, should be seen by a palliative care specialist team within 8 weeks of diagnosis. We don't have enough people for that. I would say if you're a patient, don't fear palliative care, don't fear hospice. If you're worried about palliative care killing people, we don't kill people. People who use hospice actually live longer than those who don't. And there are several studies, well-done studies, that show if you relieve people's symptoms, pain, nausea, depression, shortness of breath, they actually live substantially longer. Yeah. They even increase the cure rate. So there's nothing wrong with having another set of eyes and ears, particularly if it's a social worker and a doctor and a nurse and a chaplain and a pharmacist, particularly if you've got that whole team paying attention to you. There's really nothing wrong, nothing you can say bad about it, except if you confuse it with, oh, I might die, or I have a serious illness, and I don't even want to think about anything else. I just want to concentrate on treatment. That's what I heard from some patients this morning. I just want to concentrate on treatment. Recognize that palliative care is helpful. There's not a single shred of evidence that it's harmful for anybody. It's covered by insurance. About the only difficult thing that I can think of palliative care would do would be inquire politely, what's your understanding of your situation? Mm-hmm. And how do you like to get medical information? Are you somebody who wants all the details or something else? And if you don't want to have that conversation, you can just say, well, that's not where I want to go. But I can tell you that most of the rest of the oncology cancer treatment system is not going to ask you about advanced directive, is not going to ask you about advanced care planning, probably won't give you realistic views about what your prognosis is other than curable or non-curable, but won't tell you, well, the average person lives a year or two. Maybe it's time to get your affairs in order and get a will, get a living will. Maybe it's time to videotape or DVD your life and what you want to pass on to your kids and their kids and their kids and their kids after that. We just aren't geared up to do that in oncology. But I think we're more geared up to do that in palliative care, recognizing that some people are going to do it remarkably well. I've had people that I had them do the DVDs for their kids and messages for kids going off to college, getting married. And 3 years later, she came up to me and said, "You made me do that." I didn't make her do it, but you strongly suggested I do that 3 years ago. And here I am. And here I am. And I'm so glad I have all that stuff done because now my disease is getting worse. I don't have the energy to do any of that stuff, but it's all done. It's all done.
Yeah. And, like what you said about people with advanced cancer can be, have a few months to live or many years to live.
Mm-hmm.
We have such a wide range. And I interviewed a few people last week in our next episode of the podcast that'll drop soon this week. And some of them said that, that some of the people they're talking with, other cancer survivors, you feel like they already have a limited lifespan. So during this time of COVID, do they want to spend it at home or do they want to be doing stuff with their families and making memories? And I think it's a very personal decision, but it also has a lot to do with kind of where you are in that disease trajectory and how much time you may have. But then again, we don't always know.
You don't always know. So my wife and I did a series of mindfulness exercises with Nina Smiley from Mohonk the past couple of weeks. And the last session she did with us, with a whole group of people around the country, it's not for most of these things either or. It's both and.
Right.
So you don't have to concentrate just on getting your affairs in order. You can concentrate on getting your affairs in order and living your life to the fullest and making a list of things that you want to do and making up with your brother that you haven't seen in 15 years and maybe doing that DVD of, well, what really was life like back in Albania where you came from? Because your kids are not going to remember it. But both and as opposed to either or.
I love that. Thank you so much, Tom, for taking time out of your busy clinic schedule to be with us. I had a lot more questions I wanted to ask you. So I think we'll just have to do a podcast interview and talk about it. So thank you so much for being with us here today. We really, really appreciate your time.
Thank you, Shelley. I appreciate the opportunity.
Last week, I had the opportunity to talk with two incredible women who are living with stage 4 cancer, but not letting their cancer diagnosis stop them from continuing to help others. First, here's my conversation with Angela Jersi Baker, founder of Angel in Disguise. Jersi provides transportation, errands, and emotional support to cancer patients in the Charlotte, North Carolina area. I'm honored today to be here with Angela Jersi Baker, an incredible advocate and cancer survivor, and the founder of an organization called Angel in Disguise. And Angela, or Jersi, can you tell us about I want you to tell us first about your cancer experience and tell us about your nickname, Jersi.
My cancer experience it began in 2003 when I was 32 years old as DCIS. I took 5 years of tamoxifen. I had a local reoccurrence in 2010. And in 2011, I became metastatic. And last year, it metastasized to my liver.
And so tell us a little bit what it's like going through cancer treatment during a pandemic and with everything that's going on in the world today.
Well, because I don't take traditional chemo, I take a pill every day. I used to take shots, but when I developed liver mets, it went to a pill every day. But I still do get an Xgeva shot in my arm, which I haven't been able to get since COVID started. And other than that, I haven't been able to go see my doctor. Everything is virtual. So it's a little different with that aspect. I do still go and get scans, but other than that, it hasn't changed much.
So tell us about Angel in Disguise, how you came up with the idea for it and what do you do? What do you do?
Okay, and also you asked me why Jersey. Jersey is where I'm from, but it's spelled differently because my first dog's name was Jersey, and I just took that name and living on her legacy.
Oh, that's nice.
Angel in Disguise started in 2015 when I was metastatic. and I decided to stop working, but I didn't want to just stay at home. So I figured, what can I do to help people? And it started as a for-profit business, and I went out and handed out cards and did errands for people, and I came across a survivor that needed to go to 2 doctor's appointments, and her children were working, so she didn't have anyone to take her. Well, 5 hours later and two doctor appointments later, I was like, wow, if she needs this service, there's got to be other women or men that need this service. And Angel in Disguise was born, because she didn't have any funds to actually pay me. And I felt like, because I was a breast cancer patient, I felt like that shouldn't stop me from helping her.
Mhm.
And it's taken off. And with COVID, it's really gotten busy. We have some organizations in the area that have stopped because of COVID, but we keep going, and we're different. We don't drop patients off. We go in the doctor's office with them and so forth. But since COVID, we can't go in the office with them.
So tell us more about how it's working during COVID. I mean, how many people do you have as helping provide transportation? How many people are you working with? What are you seeing that people need during this time, and how have their needs changed?
Definitely they need transportation. I may know that someone needs a ride a week from now, or a few times I've been on Zoom calls and I've been driving patients. Sometimes I'm getting calls like, can you go get someone like right now? Because they thought they had transportation, but then the transportation fell through. And it's a really big need, because number one, especially when you're having chemo, you don't want to have to try to figure out how you're going to get to your next chemo session, or the shot that some people need right after their chemo session. And they may not have money, resources. Even if they do feel well enough to take public transportation isn't available in all areas where I live. So it's a huge barrier. If they don't have transportation, then they can't go to their appointment, and then they're missing their cycle, and you know how that goes.
Right. And cancer didn't stop with COVID. So
Cancer didn't stop with COVID. And this year we had our very first patient. She was 92 years old, and every time I went to pick her up and take her to radiation, I would just smile, because she reminded me so much of me. She was spunky, and she still drives, and she's not a breast cancer patient like me, but she is a cancer patient. And we just have great conversations, and I just felt like I was driving my grandmother.
wow, that's wonderful. And how has it helped you in your own cancer experience to be able to give back and help other people?
It makes me forget about what I'm going through and not worry, and to just talk to people and tell them about resources that are available, which a lot of them don't know. Um, it may be financial resources, it may be healthcare resources, insurance resources, and it gives them a comfort to know that someone's with them that has experienced this and knows what it feels like. Of course, all cancers are different, so I don't know everything they're experiencing, but we can talk about it. Things that they may need to ask their doctor that they may not even think of, or they forget. I'll say, don't forget to ask Dr. So-and-so this, or did you ask doctor this, or, just different things. It just makes me smile to be able to help people. And, as I always say, whether we get any more funding or not, which we're pretty much self-funded or get donations, we don't have any big funding coming in. I'm still going to do it because it's very important work to me. It's my passion.
Where did you come up with the name Angel in Disguise? You clearly are an angel for these people. You're providing so much more than transportation. You're just providing support in the most difficult time in their lives.
It actually came from a song. But the funny thing is, as time went on, I was like, this was the perfect name for this organization, because yes, I do feel like I'm someone's angel, and people don't hesitate to call me, even when they're done with their treatment, if they need me, they'll still call me. I've driven people's children to school because they had to work. So it's more than just transporting cancer patients. And we take them to treatment, surgery, to get glasses, to the dentist, anything that they need while they're in treatment.
Wow. And so where can people find out more about Angel in Disguise?
They can follow us on social media. On Facebook, it's Angel in Disguise Inc. On Instagram and Twitter, it's Angel Disguise _. And our website is angelindisguiseinc.org.
Great. Thank you so much, Jersi, for being here today, for sharing your experience, and for all that you do for cancer patients and cancer survivors in your area.
Thank you so much. And if anyone out there wants to volunteer or help us, please contact us, or if they need services. Thank you so much, Shelley, for having me.
Thank you. Wow, isn't she amazing? Now I'm pleased to introduce Isabella de la Houssaye to share her remarkable story. She was diagnosed in 2018 with stage 4 lung cancer, and she has continued to climb mountains, compete as an Ironman, and ride her bike across the country to bring hope and inspiration to people with lung cancer.
Good afternoon. My name is Isabella de la Houssaye, and like most of you, I am a cancer survivor. I am also a mother of 5, a business owner, and athlete, and am challenged every day by how to continue being all of those things with a stage 4 lung cancer diagnosis that requires ongoing treatment, bi-monthly scans, and monthly visits to an out-of-state cancer center. I've always loved a good challenge, and God has certainly given me one. Despite the difficulties, I can honestly say that the past 2.5 years since my diagnosis have been the most meaningful and joyful years of my life. And I'd like to share with you today some of the tools and strategies that have helped me not only navigate the survivorship path and be the mother, business, and community-minded person I want to be, but have also enabled me to climb some of the world's tallest mountains, compete in Ironman competitions, and most recently, ride my bike more than 3,000 miles across the United States, all as a stage 4 lung cancer survivor. The first and most important tool that I've used in learning is learning to recognize and harness the power of my own mind. One of the first lessons I learned as a mountain climber and ultra-endurance athlete long before I ever had cancer is that the mind almost always wants to give up before the body. Whether you're running, climbing, or just trying to get through the day, it is the voice in the head that starts to say things like, I'm tired. Why am I doing this? I'm afraid. I can't do this, long before the body gives up. In essence, the mind can be a powerful influence over the body, both good and bad. Learning to recognize the voices in your head and training them to stay positive is the difference between finishing the marathon, reaching the summit, or on some days, just getting out of bed in the morning. We are all challenged in different ways every day, and our objective ability to meet those challenges will vary day to day depending on many factors, ranging from something as simple as the weather to more complicated physical limitations. The only thing we know we can do every day is give it our best effort. And learning to use our minds to achieve that best effort is what I'm talking about. Studies have shown that when the mind starts to give up, the body still has 75% more left in it. The key is learning to tap into that extra 75% reserve. As a cancer survivor, this means that in addition to keeping our bodies as strong as possible, we also have to focus on building and maintaining our mental strength, learning to recognize the voices in our heads that act to hold us back and keep us from living the best lives we can live. Learning to be aware of our thoughts and how they help or hinder us is the first step in that process. And the second is using that awareness to shift negative thoughts and emotions into positive. So changing thoughts of failure, sadness, and loss into those of hope, gratitude, and positivity. I don't think anyone ever learns to completely tune out the negative, But with practice, you can actually get really good at shifting your perspective. And the key is how quickly can you reset and bring joy back into your life. When I was first diagnosed, the physical pain was very intense, but much easier to address than the overwhelming sadness and fear that came with it. Even though I had been a student of meditation and mindfulness for about 7 years prior to my diagnosis, it still took me weeks to be able to apply those techniques and shift my mindset from one of fear and sadness to one of gratefulness. And this shift allowed me to focus on all the things cancer could not take away from me, rather than all that it already had. That was really the turning point for me taking back control over my mind and body. I wasn't dead yet, and worrying about what may or may not happen in the future was not going to help me make the most of each day. I had to stay present, move forward, and focus on finding joy in every moment. And this idea of staying present leads me to the second tool that I have found to be immensely helpful: learning to stay in the present moment so that you are not overwhelmed by the totality of what you are facing. When I run 100-mile races or compete in Ironman events, staying in the moment is critical, because you will literally start to freak out if you think about the totality of what you've taken on. For instance, at mile 10, if you start to feel fatigued and you let yourself start to think, oh, I have 90 more miles to go, you will want to quit. If you can keep your mind in the present and ask yourself in that moment, can I keep going? And the answer is yes. Then that's all you have to do. You just keep going, moment to moment, mile to mile, until you've reached your endpoint, one step at a time. The mind has a tendency to say to the body, if you feel bad now, just think how much worse you're going to feel if you keep going. But that actually isn't always true. The body has an amazing ability to adjust to the stress it is under, so that in fact, the discomfort usually diminishes over time rather than increases. The problem is that many people quit before they actually find that out, because they listen to the voice in the head that tells them they can't keep going. On the opposite end of the spectrum from running a 100-mile race, a few weeks ago, I was struggling with pain in my chest, which we eventually determined was caused by radiation treatments. But just taking a deep breath was difficult and really almost impossible. My mind was worrying with the what ifs. What if the pain gets so bad I can't breathe? What happens if I have to cough and I can't? What if I get COVID-19? And the more I allowed myself to think about the future and what may happen, the more panicked I became, the more difficult breathing became. I had to work so hard just to stay calm, work with my doctors to determine the root of the problem in order to find the right treatment. That may never have happened if I let my fear and emotions take over. Mind-body research has proven that the thoughts you have, negative or positive, have an immediate impact on your heartbeat, your pulse, and energy. The second you experience fear or anxiety, your heart rate and breathing increases, your blood pressure increases, your muscles tense up. Energy your body could be putting to healing and strengthening your immune system is used instead to respond to anxiety. This physical reaction is called a fight or flight stress response, and while there are some situations in which it is warranted, most of the time it is triggered by such simple things as worrying about what the future may bring, or trying to control things that you fundamentally can't control, like your spouse or your children or the other people in your life, or even just resisting what is rather than accepting it. Whether you are trying to climb one of the 7 summits or bike 3,000 miles or get through a 3-month chemotherapy regime, you need to make sure every bit of your energy is focused in a positive way to get you through the task at hand. And you can't afford to be diverting energy to managing fear and stress. Keeping your head in the present moment and dealing only with what life presents in that moment will go a long way to reducing your fear and anxiety. Tomorrow is never guaranteed for anybody, cancer survivor or not. All we really have is today, so we have to make the most of the day by staying present to it. And this takes me to my final piece of advice, cliche as it is, and that is Carpe Diem, seize the day. There is no day like today to try that something you've always wanted to try. Say I love you to a friend. Start that project you've been putting off for no good reason. Just do it. I hear people say every day things like, oh, I wish I could run a race, but I'm a terrible runner. Or I wish I could do yoga, but I'm not limber. Enough of the excuses. I am running so slowly these days that most people could walk faster than I'm running, but that is not stopping me from trying. The first marathon I did after I was diagnosed took me 9 hours. I had to use walking sticks to support my weight because the cancer had eaten through my sacrum. I didn't know when I started the race if I would actually be able to finish it, but I knew I wanted to try, and that's all that mattered. My mantra then and now, which is taken from a Chinese fortune cookie, is failure is not defeat until you stop trying. Just go out there and try. If not you, who? And if not now, when? My cancer was stable for 18 months before it started progressing last fall. I had radiation, but I fully expected that when I went for my scans in February, there would be further progression. To my great surprise, the cancer was stable, and I told my oncologist, between now and my next scans in 9 weeks, I will bike across America to raise awareness for lung cancer. He laughed, and I know he thought I was crazy, but I went out and I did it. A number of people told me to take more time to prepare, to set myself up for success. But one thing I've learned as a stage 4 survivor is you don't put off till tomorrow what you can do today. My last scans taken after I completed my ride did indeed show progression, and I'm now in the process of trying to find a new trial and treatment. Had I waited to start my ride across America, it might never have happened. You have to seize the day. So the 3 thoughts I hope you will take away from me today are to be mindful of your thoughts and the way they can influence your body. Learn to recognize when your thoughts and emotions are not helping you so that you can then learn to adjust your thinking to a mindset that is positive and that will help you stay strong and present and live the life you want to live. And finally, there's no time like the present to start living that life. I can't promise that these tools and strategies will add years to your life, but they will certainly add life and joy to your years. From my heart to yours, namaste.
Thank you, Isabella, Jersi, Dr. Smith, and Caitlin, all of you for sharing your experiences with us today in these conversations about living well with advanced cancer. We are really grateful for all of you being here today. Now we'll have a short break until 1:30 p.m. Eastern Time, when Lindsay will moderate a discussion about advocacy in action with a group of incredible advocate leaders. Thank you.